Immunization is a key component of the universal health coverage and one of the most cost-effective public health measures in reducing morbidity and mortality from disease. The fire incident that occurred in 2017 at the Garissa depot not only damaged the depot, but also resulted in disruption of immunization supply chain for Mandera, Wajir, and Garissa. Frequent distribution trips between the central vaccine store and the counties will now be a thing of the past, given that the depot has now been renovated and equipped with a new cold room, 4 freezers, and 1 ultra-low temperature freezer to cater for the population needs of Wajir, Mandera, and Garissa. The availability of the ultra-cold chain equipment will now enable the counties to deploy vaccines with special requirements, such as Pfizer COVID-19 vaccine. In addition, the county depot that had been established in Mandera and Wajir continue to complement the vaccine supply chain, reducing the times and stockouts of the facility implementation level. The Ministry of Health, in line with the Bora Afya Mashinani initiative, is keen to ensure that primary healthcare services reach those who need them in good time. The ministry is committed to supporting devolution and collaborating with counties to make this a reality. The Garissa Regional Vaccine Depot renovation has bolstered our efforts in fight against the vaccine preventable diseases. This year, Kenya has experienced outbreaks, including yellow fever, for which vaccination response was conducted in July. Ladies and gentlemen, following the detection of measles outbreak in several counties, the Ministry of Health is conducting a vaccination response in 7 highest risk counties, that is Garissa, Mandera, Wajir, West Pokot, Marsabit, Turkana, from the 9th of December to 18th of December. The outbreak is as a result of accumulation of children with low immunity due to low vaccination coverage for routine measles vaccine doses. The situation has also been compounded by the drought and movement of people. The Ministry of Health targets to vaccinate more than 90% of the children aged 9 months with the first dose of measles, rubella vaccine, and those aged 18 months with the second dose of vaccine. Our coverage for the first dose is 87%, while that of the second dose is at 57%. It is therefore not surprising that we are experiencing outbreaks, especially in areas where the coverage is below 80%. Measles is a highly contagious viral disease which affects mostly children, and those below 5 years are the most at risk of severe disease or even death if not checked. Therefore, the ministry is targeting the vaccination of all children between 9 and 59 months in the high-risk counties with an additional dose of measles and rubella vaccine. The vaccine will also protect against rubella disease, which resembles measles, like you are told earlier by the Director of Medical Services. I therefore would like to take this opportunity to urge the public, parents and guardians to make all efforts to ensure that their children who are below 9 months and 59 months receive this additional dose of measles. You are told by your deputy governor that this is something that has been taking place over a period of time. Na yeye mwenyewe akasema alidungwa, alipatiwa hiyo vaccination. Lakini ameniambia pia ako na watoto. Amezaa watoto. Kwa hivyo yule mtu anakuambia ukiwa vaccinated huwezi zaa, hiyo ni uongo mtupu. Mimi pia nilipatiwa vaccination, mimi natoka upande ule wa Nandi. Wakati nilikuwa primary nikapatiwa vaccinations mara 2. Na wale watu wa umri wangu wakati huu bado wako na hiyo scar kwa mkono. Lakini nataka kuwaambia saa hizi niko na watoto wengi na nami pia nangojea wajukuu hivi karibuni. Kwa hivyo msidanganywe kwamba ukishapatiwa hiyo chanjo huwezi zaa. Mimi mwenyewe nilichanjwa na nimepata watoto.
We have this campaign that will be launched or we are launching right now, in 7 counties. And we hope that with the health workers that we currently have, they will help us to succeed in making sure that 1.2 million children are vaccinated. Distinguished ladies and gentlemen, UNICEF is pleased to officially hand over the refurbished Garissa Regional Vaccine Depot. This will ensure we have more access in terms of vaccines supporting those counties.